morning, Arild. Thank you so much for joining me for a conversation around how COVID is impacting on people around the world, particularly people who use alcohol and other drugs. Can I ask just if you can introduce yourself, tell us where you are on May the 26th, 2020.
Hello, Adam. Thank you for having me. My name is Arild Knutsen. I'm the leader of the Association for Humane Drug Policy. I am in Oslo, Norway. I'm a drug user activist.
And you've been at the forefront of more rational drug policy and drug treatment in Norway for a long time. And to the outside world, we see Norway as being the most progressive of all Scandinavian countries. So we would hope at a time like this, the government's response to COVID to protect the most vulnerable in society would have been really positive. But I have no idea. Can you tell us, first of all, what's been the impact of COVID on everyone's life in Norway? Has it been a little?
Well, we had quite a big lockdown, closed borders, everything. So we have been quite strict in the locking down the society. So we don't have much COVID-19 and many deaths compared to countries like Sweden.
Okay, so you locked down your borders. Were schools closed? Were shops closed? Bars and restaurants all closed?
Kindergarten, pubs, bars, hotels, everything except a grocery.
And is that still the case as we speak now?
Right now, it's very fantastic to see outside because it's opening up a little. It has been very successful restrictions. So now we see people out in the street again, playing music, selling street papers, and more and more. But people they are very careful. They are having their distance between each other, not too many people at one place, and you can go to a pub and drink a beer, and so it's more social. The social life is back outside.
Okay. For the last couple of months, though, what's been the impact of COVID on people who use drugs in a problematic fashion? Has it been significant or not? We
were very frightened in the beginning, because we were fearing that there will be shortage of drugs, real shortage, and more overdoses and COVID virus. Because if you get COVID virus we have open drug scenes in our cities, big open drug scenes. Our cities look like a typical European cities in the 80s. And so if we would get COVID-19 in there, it will spread rapidly. And this is a group that live 20 years shorter compared to the rest of the citizens. So 10 years shorter than people with cancer. So we were very afraid, and now we have no virus in the drug community. And so we can only speculate why, but we think it's because they are so marginalized, already isolated from the rest of the society, and also being careful like anyone else. So it seems like we have a little fewer overdoses, no virus, and the life goes on, and we have some shortages of cannabis, some shortages of benzodiazepines, the strongest ones, and a lot of people in the suburbs and around the country who live more stable lives but use heavy drugs. Now they can get the heroin where they used to, or the amphetamine. So they are now coming into the city to the open drug scenes. So, and we see that's not good for them because there's more drugs, cheaper drugs, more unstable people to be with, and so we see that's not good for them. And we see a lot of heavy drug users who are in substitution treatment, who are stabilizing their life with that and cannabis. Now it's hard for them to get cannabis, so quite a lot of them start using harder drugs instead of cannabis because they can get it, and that's very bad for the mental health. So it's more aggression, bad mental health, and so on.
Why wouldn't people switch from cannabis to alcohol? Wouldn't that be a more obvious transition?
A lot of people are unfortunately switching to alcohol, and that alcohol is a bad drug. So that's not good for their mental health. That's not good for their health. That's not good for anything. To switch from cannabis to alcohol, because that's one of the worst drugs. So that's a part of that explanation, that you can see when people can't get cannabis anymore. This is people with bad health already, drug history, and when they cannot get cannabis, they start to alcohol. It's very bad for them. So this has taught many politicians and many people in the media that shortage of some of the illegal drugs is not good. And that's quite important teaching.
Absolutely. But it sounds like the already good quality of healthcare within Norway, the early lockdown of the borders, and everyone complying with social distancing has protected everyone, including vulnerable drug-using populations. Have there been more?
No, we don't agree with that, because in the beginning, in the 12th of March, they had this big lockdown. We don't agree that they should close down the shelters. They closed down the drug consumption room. They closed down giving out food and places to come in to get health care. In the beginning, they just closed it down. And when the closing down works good in general, this group, they are sitting tighter together, injecting outside in the street, instead of they can come in and have this professional effort to keep the distance, to have the hygienic situation good, and food and sleep and so on. So that was not good, but they adapted very fast and changed the healthcare services. So now it's quite good.
Okay. Have more people come into substitution treatment now?
It seems like that, yes. The substitution treatment, they are still in discussion to have more low threshold substitution treatment, and some is getting it faster. And into opiate substitution treatment, they are earlier it will take you weeks. Now it can take you only a few days to come into opiate substitution treatment. And also, because now we're having, especially in the biggest cities, isolation units, so that you can voluntarily go in and be isolated if you have drug problems and COVID-19. So that started discussion. How can we keep them there voluntarily? What can we do so they want to stay? Okay, they have to have benzodiazepines, morphine tablets, methadone, buprenorphine, but what about all those who are addicted to amphetamine? So now is political work going on to suggest amphetamine substitution treatment, and that's so this has moved us. It's like every virus. When you had hepatitis B in the 70s, you started to make sure that the pharmacies had free syringes, and then we got hepatitis, now HIV. We got drug consumption room, handing out syringes, substitution treatment. It turns off the narco ideology, just saying no, into health measures. So this has been so important. And also with COVID-19, this has made us look into what can we really do. And it's quite sick that we are substituting heroin for 8,000 people, and we are not substituting amphetamine, cocaine, or benzodiazepines. That's weird, but that's because some ideology is hindering you in thinking rationally. And this COVID-19 situation now it's public health. We have to think public health, and then what about the amphetamine users? So now it's a document. We will soon see what the health directory and what the Department of Health is saying about it, but they are really considering this seriously.
It is a unique opportunity to at least research what the impact is of stimulant substitution treatment. So, there has been research over the last 20 years in different populations, normally on a small scale, where prescribers will offer oral amphetamine substitute to wean people off injecting. But most of the research would identify it's those people with adult ADHD, perhaps with criminal histories, where there is the greatest benefit. what you're doing is challenging that idea that public health and individuals would be better off if they were able to get a legal substitute amphetamine drug than score illicit amphetamine, erratic binges, mental health problems. It's another example of a pragmatic response that we're only able to consider because of a crisis.
Yes,
true. It sounds like there is an opportunity to learn. Doctors like myself, though, get suddenly shifted out of a comfort zone where it's like, well, I haven't thought about doing this for 20 years. Have I really been that wrong? And a lot of us are having to sit back and look at guidelines and treatment policies that we've probably never questioned that much and gone, we need to learn from this. So it's fantastic that Norway are having those conversations. So it sounds from what you're saying, you're quite hopeful that there might be some longer term changes in drug treatment delivery and drug policy that may come out of the COVID-19 situation.
Yes, but we are already in a drug policy reform. We're transferring the responsibility for those caught with drugs from justice to health, decriminalizing drug use and possession. So inspired by the Portuguese model, but there is a lot of moralism that makes people punish people for using other drugs than alcohol. And I think the COVID-19 situation helps to get rid of some of the moralism in the health measures, so we can also substitute other addictions, serious addictions. And we are already, last year we changed the heroin injection sites to drug consumption room. So it's less narrow, less limited. It's hard to have good health measures for those people that the overall policy is to punish. Then you have to limit it. You must not go too far. But now that we're in a drug policy reform, we are opening from injection site to consumption room, and within a year, Mike, we'll have a heroin prescription, heroin clinics in Oslo and Bergen. It's already decided. It's building up right now for 300 persons. And in that perspective, when you get this COVID-19 situation, you have to see, when you treat this group less as criminals and more as a health issue, then we can think longer than we have before. And we can see that politicians in parliament, people in media, commentators and so on, are pointing out the bad situation when we get shortage of heroin, when we get shortage of amphetamine and shortage of cannabis. People are frustrated by the shortage, and then you understand that this policy is not very good. We have to do something.
I wonder how the Norwegian government would take to the idea of offering alcohol substitution, because of course there are clinics in Canada and Switzerland and elsewhere that offer rations of alcohol to bring in people where they can get housed and fed and looked after. I can almost see the general population almost freaking out more about giving alcohol-dependent people alcohol than they might do amphetamine, because all of a sudden it's like, well, alcohol's a drug I use. So it almost sounds like COVID's come at a time when Norway was going to be really receptive, and in fact COVID's going to be used to push forward the agenda for change that you're already on.
We are discussing in some places alcohol substitution, at least for older people. Of course, if you have dementia, you don't remember, you go out and you drink anything, and the situation becomes very bad, so they can go to the treatment center or a place to live for older people, and they can drink just milder versions of alcohol sometimes every day, and they live in dignity. So it is starting up very a little in Norway also.
So the final question I want to ask you, because hopefully over the next week we're going to interview people from Sweden and Finland and Denmark, and Norway is leading the way in Scandinavia for drug policy reform. Can you give me your predictions on your neighbouring Scandinavian countries about how long it's going to take them to catch up with Norway? Who's the closest to you, and who's going to take the longest to see the world your way?
I think Denmark has gone in front of us for quite a few years, and now we are going in front of them, and I think they will be inspired. And I see that it's raising a debate also in Sweden. Last year we had 5 members of parliament from Sweden at our office at the Association for Humane Drug Policy. We showed them the drug consumption room, the open drug scenes. We discussed heroin prescription, decriminalizing, told them why we are against prohibition and everything. And they were just so supportive because they had spoken to our health minister, who's from the same party, the Conservatives. So they were like this. And they were members of parliament from Sweden. And that committee in the parliament, just 6 months later, they suggested to find out if Sweden can change their drug policy and look into if decriminalization works. Because we have this report from a committee in Norway looking into Portugal, looking into all European countries, legalization of cannabis in the United States. They cannot find any evidence that criminalizing drug use works. So, and of course, if you stop criminalizing, then you can get into health measures that we know works. And I think they are learning about that. So the debate is racing in Sweden and of course also Finland. We see that there are more and more progressive groups taking contact with us in Norway. So look to Norway. We are going into great drug policy reform with evidence-based drug policy. And other authoritarian, politicians in other countries, they misunderstand. You cannot be hard on criminal, tough on crime. That is not the way in drug policy, because when you're tough on drug users, you're just harming patients and ordinary citizens, and then you're turning your back to crime. So that's not being tough on crime. And I think many of those kind of countries will learn that, because it's not so, it's quite, I think people are very, surprised that Norway in the north of Europe is going this progressive direction with a conservative party in parliament.
But that's what makes you such wonderful flag bearers. It's like, this is a really sensible conservative population that is pragmatic, rational. Like, if they're doing this, you have to accept there is an evidence base behind it. And I love the fact that politicians are desperately searching for some benefit of criminalization. And that's even before they start to look back at all the harms of criminalization. Not just economic harms, but, you know, I mean, adding to the physical health risks and psychological health risks of individuals, communities, and families. It's incredibly inspiring. And I guess that's why I wanted to talk to you, because, yeah, I think Scandinavia is going to be a place people look to. Because you don't do stupid things. Like, yeah, you're sensible, pragmatic people, and it's so good that politicians are listening. Is there any last thing you would like to say or share before we say?
I'm very proud of our government, and I'm very proud of our politicians, and we are respecting them, and we are proud of them, and therefore they are respecting us, and they're proud of us, and we're working together, civil society, drug user organizations, and politicians, and that really, you can see that the results are very positive for us all. So the drug user organizations, there are 5 in Norway, they are very strong, they're working like well-paid special advisors for the government, for the parliamentarian, for the Department of Health, for the health directory, everywhere we are asked, they really need us. And that's because this is a great society. We use the first name to each other. And when you have this drug policy reform, they call us and go out with us, because this cooperation is just fantastic. And that's being tough on crime, because it shouldn't be tough on people who are vulnerable. So this is a real fantastic development. Norway is a beautiful country with a beautiful welfare society and a beautiful political situation.
We have had no one on any of these interviews who the last thing they've chosen to say is, I'm proud of my country, I'm proud of our government, I'm proud of our politicians, because we treat them with respect and they treat us with respect. There is no better place to end this. Thank you for sharing perhaps the most valuable lesson of all, which is mutual respect is how you move forward and you get things done.
Thank you.
I'm almost floating. It's a beautiful place to end. Thank you so much for sharing that, and hopefully for showing so many other people this isn't that difficult if you have honest conversations and you're respectful. Arild, thank you. Hopefully we'll get lots more Norwegian people doing the survey before it closes. I'm going to say goodbye. Thank you so much.
Thank you for having me. Bye.
Right, and then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or?
So the question that you chose to ask, will it be better where we're going? And though the answer I don't know for fact, still my heart is saying, oh yeah.
Still just taking it one day at a time. Still don't know what I'm trying to find. Really, I don't